So dear friends, now we're going to have a short massage session, foot massage. As you can imagine, our patient has 2 feet, but we will work only with one. Now we will work with one, but you should work with 2. The first important thing I would like you to do is to get in touch. We do not grab our patient right by the leg and do not start twisting one's toes. We just start touching gently, very leisurely. If the person starts to shudder, then the one is not ready for our touch. Be present with the person, raise your patient's leg. I like to work in this position when I am coaxily behind the person, but for the convenience of the video, I will be in this way with the patient's ankle resting on my hip. This is a good option because it gives my patient confidence. The leg will not fall anywhere, even if the person tries to move it somehow. The leg won't fall anywhere. We will work with oil. I like olive oil. You can use any oil or cream you like. The main thing is your mutual convenience. We start with a gentle stroking motion. It may happen that a person gets tickled when you touch the foot. In this case, make a tight enfolding calm movement and fold the leg. Allow yourself to breathe with the person for a while. Be present with the patient in this process, and often that should be enough to make the tickling go away. If the person still in tickles, then it makes sense to stretch the foot, dorsal and plantar flexion. Stretch the toes. These 2 techniques of stretching and your presence in 98 cases remove the tickling from the foot. And so we proceed and begin to slowly stroke the foot with soft circular movements. Change the surface you're working with. Now I'm working with my thumb. I can work with the top of my pinky finger. I can work with the base of my palm, making gentle circular movements. I can rub the foot on one side. I can rub the foot on the other one. I can stroke and rub both together. The arc of the foot is very important. Here from the inside, the muscles that hold the arc of the foot are attached. The inner arc is where I need the place of attachment of tibialis posterior muscle. Here, twining, the posterior tibial muscle goes in this way and it is attached here. In the other side there are peroneal muscles and they come together here. And if we have problems with flat feet, you should not believe that flat feet are forever, and that if you are 30 and you have flat feet, then it's time to slowly crawl to the churchyard. This is not true. Flat feet are correctable. It just requires effort and attention from you. For watching how to work with the peroneal and tibialis posterior muscles, we have separate videos. I think you can find them. In foot massage, it is important that we knead these areas here. They can be quite painful, or on the contrary, they can be very pleasant. We don't hurt our patient. We work with these areas at the level of light, pleasant pain. Another important location will be the far inner arc of the foot. This is the attachment point of the tibialis anterior muscle. Also a very important place. We can massage it too. And here along the inner surface we have a muscle that moves the big toe. It comes from the big toe. Here it attaches to the joint and attaches to the inner front heel. Muscles go in this way. Working with it will help you condition of the bunion if there is such a problem. In addition, it is quite pleasant from the inside to the patient. It makes sense to knead it properly. If you do this regularly, after a while you will begin to feel it. It is perceived as an elastic roller right here. In this sense, I know that on the one hand I'm working with the muscle that moves the big toe, and if I go a little deeper, then I work with the joints and attachment points of the muscles that hold the arc of the foot. These are different layers. If you don't understand, do not despair. Experience will come to you a little later, and we alternate our movements with periodic stroking, periodic kneading. We make sure that our movements are pleasant both for us and for our patients. It is no coincidence that I put myself as a person who enjoys in the first place. The main thing is to have pleasure as the therapist, and a way the patient will be able to experience pleasure. You see, I use as much surface of my body as I can, using my forearms, my palm, wrists. This is in order to massage the foot as fully as possible. The fact is that the foot is small, fingers get tired very quickly, so try to use as much surface as you can. An important point is checking the outer edge of the foot. Here I am folding it with the pinch grip, begin to move along the edge of the foot. This area is extremely rich in nerves endings, so kneading it will be pleasant and very useful. It makes sense to knead the outer front heel. It may be so that you pinch the skin or soft tissues. That is, you can go in and take and go along the bones and go inside of the foot, or you can work with the soft tissues without touching the bones. If the person has corns, try to grease them with oil more and slowly pluck them out like this. Pluck out these corns, and after a while they will decrease and may even disappear. Why it helps us? Because we provide the body with the load of a different kind, and the body, in an effort to adapt to a different heterogeneous load, activates processes that lead to the decrease in corns, to the increase in blood circulation, to better skin peeling, better skin hydration, and so on. For example, here we've massaged the outer surface. I would like to draw your attention to the fact that the outer and the inner heels are reflex zones that are responsible for the pelvis, so these areas are very useful in terms of massage. They can sometimes be quite painful, so be careful. People here often experience edema, and if there is edema, then with soft sliding movements we begin to drive the lymph up the popliteal lymph nodes. We help the body. An important place is here near the bones, outer bone at the back side, outer bone at the front side. A huge number of tendons pass there. There are tendon holders that allow the ankle to be narrow and graceful. Very often in these places there are multiple injuries, ruptures. These areas may be painful or swollen. Do not be shy. Knead them with soft, rotational movements. The main thing is that we do not show too much zeal or passion. Everything is fine. We focus on making our patient happy. For example, as now my model said that she was very pleased. And this means that we are doing everything right. When in doubt as to whether you are doing right or wrong, if a person is pleased, then this is a sure sign that you are doing everything right. Be careful, sometimes hypertensive patients like rather strong influences. It is nice to them when they are massaged strongly. Resist the temptation to work with the person harder than you wanted to, especially the first session. In the first touch we are careful, and we massage a person very carefully, very carefully. Of course, if we talk about important places, then a very important place is the middle of the forefoot, where we have located. When we collect our toes into a fist on our foot, here we're trying to collect our toes into a fist, and here we should have a dimple. This is the beginning of the kidney meridian. It starts in the center of the foot, here, in the front, and runs along the inner surface. The kidney meridian is responsible for the cold in our body, for the energy in our body, for water exchange, for gynecology, a lot of important functions. And you can work with it by activating this point in the center of the foot here. A very important point. It tones the person extremely well. Rotational motions, as you can see. There are quite a few rotational movements in the massage that I'm showing you. We rotate in one direction, in the other. And of course, there are features where to rotate, why to rotate, how much to rotate. But we do not dive in these details. In many ways, the feeling will come a little later on its own. But in many ways, it is not so important. Look at the next thing. I grab hold of it with my hands and begin as if to dive with my thumbs inside the foot right here, stepping from one to another. Sometimes it is great, even if you have fingernails, slightly enter this space with your fingernails. Be careful, this is not always pleasant. Sometimes it is very pleasant, sometimes it causes rejection in people. Try gently at first, and then gradually increase the impact. A very interesting area. People really like it when you do this. When you grab the membrane, this can be painful, be careful. If you feel that it is painful, if you feel that your patient has stopped breathing, or one's leg has somehow tensed, or the one begins to fight back or crawl away from you, then you have taken too tightly on your patient. Loosen the impact, but do not let go. In order for your patient not to crawl too far, it makes sense to take the big toe from the other side. If you unscrew it, then the patient will relax and you can continue to knead the membrane. It was a joke. But nevertheless, here is the membrane, both very pleasant at times and at times a very painful place. As you can see, we have 5 toes and 4 membranes. It makes sense to work with each one. You may be surprised to find that for different people, different membranes are painful. These are important reflex areas, and depending on which membrane is painful, this tells us that different parts of the body are in an active, painful state, and you don't have to know which parts they are. You can go find it in books, reference books on Suchok. It is enough to find. But this is not important for you. You feel that something hurts, and you're working with this place, and something in your patient's body changes, and it is good. An interesting story is the toes, very sensitive lateral surfaces. You can pull them out slightly, and you can again rub these spaces with your index finger and thumb. The fact is that our foot is the place on which we rely, and therefore we build the entire body relative to the foothold. As soon as we have some kind of distortion in our feet, the whole body is forced to adapt in order to adjust to these distortions. The whole body adjusts to these distortions in the feet, so whenever we work with the foot, we work with the entire body, exactly due to the fact that the body is forced to adapt to the feet, and of course the feet adjust to the entire body. This is a mutual process. And so we've massaged the toes, massaged the membranes. A very interesting place here on the territory where our toe pads begin, I would say. If you go into the space between the toe and the pad of the toes, you may be rewarded with a wealth of experience for your patient. A very rich place in terms of sensations. I repeat once again, the foot is a place where there are very vivid sensations, unpleasant or pleasant. And the longer we work in the area of unpleasant sensations, the more pleasant they become. Show tenderness, solicitude, patience, and suddenly it turns out that a person's foot response to your movements becomes softer, more plastic, changes its color and texture. And here is another thing. We've worked through everything in detail, worked through everything separately. Perhaps a person will ask you to stay in some particular place, do not deny to the one this pleasure. You have found some place and begin to move concentrically around this place, and then again you go to this place, looking for paths connecting this place. You start looking for ways where this place leads you, and perhaps the pain will go somewhere, or pleasant sensations will go somewhere. This is a very common story with the food. The next thing I would like you to try is to enfold tightly. Be careful, it can be painful at times. Here, our patient was now trying to kick. This is fine, therefore we sit with our back so that she does not hit us somewhere in a sensitive place. And we start in this way. Look, I took by the toes and started to knead the food, softening it. The fact is that there is a huge amount of muscles in the food. Many of them have never consciously worked, so if you give a person a load on them, it will be an extraordinary, wonderful experience. We accompany. If we don't know what to do with the food, then we begin to iron it many times. It may be that ironing that you do purely mechanically is extremely enjoyable and rewarding. Don't be shy that you repeat one movement 2, 3, 5, 10, 50 times. If you're not bored of doing it, do it even 100 or 1000 times. Many times. And the last movement that I would like to show is here. We grab the person's ankle and begin to stretch the leg. And if you try to get into my state, you will find that I like everything I do. This gives me great pleasure, and it is very important that your actions give you pleasure. And if you manage to touch a person with real pleasure, with a good, very good probability, your patient will enjoy it too. We finish with very soft movements, stroking. You can go to stroking upward, this will also be very good. And after that, we move on to another fruit.